How many are you all planning to take at least one of them in the in this coming year or in the future? Oh, good. Okay, so there's a reasonable interest in the audience. So there will be a little bit of overlap along with what Devendra discussed in terms of how to prepare for the examination and the equation that the ICO has with the FRCS. So first, when we talk about the ICO examinations, this is different from the FRCS. This is an assessment examination, which in a way tells you that if you've cleared the ICO examinations, you're on level with your peers and are of a certain level of competence. It may increase job opportunities for you. And of course, like Devendra mentioned, you have the joy of giving an exam, which all of us, for some reason, have. And we love adding initials after our name. Also, the ICO examinations, by virtue of being as expensive as they are, is a good way of making sure that you actually study in residency. And now, with as Dr. Devendra mentioned, there is a reciprocity with the FRCS, the Royal College of Surgeons of Edinburgh. How does it work? If you've appeared, so essentially from this year, the FRCS Edinburgh, as of now, is not going to be taking any more examinations because it stops at the MRCS level over here. So if you've given your ICO basics, that is equivalent, basic sciences and optics and refraction, that is equivalent to your FRCS Part A. In addition, if you've given your clinical sciences and the advanced, that would be equivalent to your FRCS Part B, and by virtue of that, you can apply for the to become a member of the MRCS ED. They are still in the stages of evaluating their plans ahead. So as of now, there are no FRCS Edinburgh exams that would be conducted in this next session. The ICO examinations also make you eligible to appear for the ICO, apply for the ICO fellowships. These are 3-month, 6-month, and 1-year fellowships, and the website clearly says it is recommended that you sit for the ICO examinations before applying for fellowship. Although there is, we all of us know a couple of people who have been awarded these fellowships even without taking the exam, but at the end of the day, when there are so many people applying for that limited number of fellowships, it is better to be on par with the rest having appeared for these examinations. So you also want to see what is the benefit of doing it. Just because everybody else is doing it, should I also do it? So you do get the opportunity to add the post-nominal FICO initials after your name. It, as we've said multiple times, it helps you have a little bit of more ease in navigating through the FRCS maze and possibly better job opportunities, but it is not a qualifying examination that allows you to practice in an additional country, unlike the FRCS. The ICO fellowships, like I mentioned, can technically be done even without the examinations, and at the end of the day, all of these exams cost money. So, which are the different exams? I'll quickly go through. There is the visual sciences, the Part A, best to be appeared during your residency. It's 120 questions, 4 choices, multiple choice answers. These are the subjects that are covered in that. They are plain regular anatomy that you'd read in your first year, along with a lot of other things. Significant amount of weightage given to genetics, epidemiology, and pharmacology, so you just can't leave that and go. The next is your Part B, optics, refraction, and instruments, typically clubbed with Part A. You can take both together. 60 questions, 1.5 hours, multiple choice. Remember, if you take Part A and Part B together, the candidate must obtain passing marks, each of these 2 papers separately. So, and if you do not pass any one, you can reappear for that individually, and only then can you take the Part C, which is the clinical side. Excuse me. The best time to take this is just after residency, because you've just read your Kansky or whichever reference textbook is cover to cover, 200 MCQ, single best answer, and as you can see, most of the topics are primarily what you've already read throughout your residency, nothing unusual in this. Finally, the advanced examination. They need you, this can be done after residency. If you're planning a fellowship, can be done during fellowship. It is called a competence and technical ability test. So it does not verify your training or your practical competence. It's just an exam to see how you know your knowledge level. These are extended type matching questions where you have 75 context setting description. They'll give you a case, they'll give you a case description, or maybe a photograph, a diagnostic investigation, and 4 associated statements which require a single best response answer. They also are now have started the subspecialty examination in the following specialties over here. Each of these specialties also has a cataract examination part within it. It needs 1 year's clinical experience after having trained. It's a 2-hour exam, and again 80 contextual setting descriptions, which are case-based questions. A single best response is to be given. The fees, yes, if you start from the visual sciences, optics, refraction, clinical, advanced and subspecialty, you will pay 1,73,000 as per January's exchange rates, which is quite a bit of a amount. But of course you stagger it so it doesn't hit you all at once. How do you prepare? This is where most of it is what Dr. Devendra already mentioned. The basic sciences, the essential reading for that is Elkington Clinical Optics, which is in its 3rd edition. Dr. Khurana's textbook of optics and refraction is also an equally good book. John Ferris and John Forrester are recommended reading as per the ICO curriculum itself. So before the examinations, you should read. From anecdotal experience and from our own, from what we've heard from people who've taken the exam and also what we've noticed, a lot of MCQs from Ferris tend to come verbatim as is in the textbook, in the paper, which helps a lot of us Indians who are so used to reading by rote and learning it by heart. So, we are also able to pick up, oh, this is exactly the wordings that is what. So that may be of an advantage to read that book well. Lamkin, the Massachusetts Iron Year Infirmary that was discussed earlier is again a great book to read for clinical sciences. Kansky, this is how it looked when we took the examination. This is how it is now, and it's also undergone a name change, and now it's back to Kansky. Then I come to ICO examinations. There are different types of ICO fellowships. They have the 3-month, the retinoblastoma fellowships. They have subspecialty fellowships dedicated to uveitis, glaucoma, and ocular oncology. These are for 3 to 6 months. They have a 1-year retina research fellowship also, as well as the Fred Hollows 1-year research fellowship. Ocular genetics and the Allergan partnership fellowship are for 1 year, but they are only in the area of basic sciences and ophthalmic genetics. I'm going to focus primarily on the 3-month fellowship because these are the ones that the ICO awards widely. There are almost 90 to 100 such fellowships awarded each year. The stipend or the scholarship that is given to you is almost $6,000. You need to have completed your entire training as an ophthalmologist to be eligible to even apply for the fellowship. If you're still in training, you cannot apply. So you have to finish your residency and only then apply. You could be in your fellowship or having completed your fellowship. There's an age cap, 40 years. And you also have to give an assurance in writing that you will return to your home country after your fellowship. The application process is extremely transparent. The website is icoph.org, the ICO, International Council of Ophthalmology. And in the how to apply section, they have it in very clear steps. Select the fellowship that you want to look for, a 3-month or a 6-month. Complete the eligibility check. The eligibility check is basically where you upload your documents confirming that you are a trained ophthalmologist, you hold your qualifications and are fit to practice in your country, along with a few other supporting documents that they ask, like your proof of age and identity, etc. In a turnaround of 24 to 48 hours, they get back to you telling that you are eligible for a fellowship and now you can proceed. Once the eligibility review is done, they have a directory where you can choose the host that you want to. You can look up which area of specialty you are interested in, or if there's a particular person with whom you want to be trained in, you can look that person's institute and directly apply through the ICO website itself. You do not need to write to them individually if they're already in the directory. The matching is done by the ICO. They receive your application, and depending on your application status as well as your credentials, they will accept or decline. and then you get a note saying whether it's been accepted or not. It's fairly transparent, takes about 2 to 3 months, and then you get your reply. However, if this entire process, once after your first application is rejected, the ICO has a very clear policy that you cannot apply for any fellowship, for any 3-month fellowship again. You can apply for a different duration of fellowship. Sometimes you may have a particular interest in a fledgling subspecialty or a particular research project, and that institute where that cutting edge technology is available or that area of research is being done is not in your host directory. As was the case that happened to me, and I wrote to ICO. They said that there are these cases, this is a screenshot of the email that they wrote back to me, that you can actually write to them and explain your situation. If they do accept an observership or a fellowship for 3 months, give us that invitation letter and we'd be happy to consider it.
Akshay, last minute.
Yeah, this is just wrapping it up. Couple of things that you need to think of is when to do your ICO fellowship. I strongly advise that doing a fellowship in India is better than, before your ICO fellowship is better. You already have a reasonable amount of competence and surgical skill, such that even by mere observation, you are able to know whether you can duplicate this back when you go, as opposed to a resident who is relatively fresh and may not be able to apply that into their clinical practice. Don't think of it as just any other vacation. And 3 months is optimal, but at the end of the day, you have to ask yourself these are not just questions I want you to ask yourself, these are actual questions that are there in the ICO application form. So you need to come up with solid answers that work with the ICO and convey that you are interested in it and that you're going to come back and practice in your host country. I'll skip through this. I had a 3-month stint at the New York INR Infirmary in ocular oncology. We were able to publish a lot during that time. Yeah, so finally at the end of the day, you have to plan well. If you apply for a 3-month fellowship in 2019, when the application date is ending in March, the chances are you would get a 3-month slot somewhere in the middle of 2021. So it doesn't fit as per your planned calendar. You'll have to plan things according to that. So take into consideration the decision of the inputs of everybody, your family, your employers, because they also have a stake in your career. Chart a timeline. At the end of the day, the ICO examinations and the fellowships are an asset that can help build your practice, add to your skills, and improve the quality of your practice. If you have any queries, I'd be happy to reply to you personally on email in case we do run out of time for Q&A at the end of this session.
Thank you. Thank you so much, Akshay.